Stop telling your patients to watch for blanching. Here is what vascular occlusion really looks like in your melanated patients. I'm about to share something that could completely change how you assess vascular occlusion in your melanated patients. Most injectors are trained to look for classic signs like blanching and tissue changes, but these symptoms present completely differently in darker skin tone. After treating multiple of diverse patients, I have identified 4 critical signs of vascular occlusion that most injectors miss. Missing these could mean the difference between saving and losing a tissue. Point 1. The bruise that isn't a bruise. Here is the first sign that catches most off guard. Necrosis in darker skin tone often masquerades as a simple bruise. While you're waiting for classic sign or gray tissue changes, your melanated patients might present with a subtle purplish discoloration that's easily dismissed. The key difference: a true bruise will always have color variation, while early necrosis presents with a more uniform darker purple tone. I actually have a case study on this that I'll share in just a moment. Point 2. The cultural pain barrier. The second sign is particularly tricky because it involves understanding cultural differences too. Many of my melanated patients have been conditioned to downplay pain. Sometimes they'll even deny entirely. I had a patient last month who rated her pain as a 2 when it was clearly severe. This is why you need to look for signs like changes in breathing pattern or facial expressions rather than relying solely on verbal reports of pain. Point 3. The hidden swelling. Let's talk about how swelling presents differently in darker skin. Instead of obvious redness and inflammation you are used to seeing, look for subtle changes in skin texture and tension. Run your finger gently across the treatment area. You are feeling for any difference in tissue resistance. This tactile assessment is more reliable than visual cues in melanated skin. Point 4. The delayed capillary response. This is perhaps the most misunderstood sign. The traditional blanch test is practically useless on darker skin tones. Instead, you need to assess capillary refill differently. I'll demonstrate exactly how I do this, but the key is understanding that normal refill time is longer in darker skin tones, so you're looking for significant variation from the patient's baseline instead. Understanding these 4 signs is just a start. You need to know exactly how to respond when you spot them. In my next video, I'll walk you through my step-by-step protocol for managing vascular occlusions in melanated patients, including use of dissolvers and specific wound care instructions. Hit subscribe or follow so you don't miss it, and drop a comment below if you ever encountered a different presentation of vascular occlusion, especially in your darker skin tones. Let's learn from each other's experiences.